Hi, I'm Liz Marquis, and I'm here to help you support the older adults in your life. This is Aging Well Anyway, a podcast dedicated to empowering those navigating the journey of aging and celebrating the life that comes with aging well. Let's get started.
Being in the hospital can be stressful, even when it's a planned hospital stay. Today, we're going to talk with Kelly Wheeler, a longtime director of admissions and patient advocate. The main part of Kelly's job as an admissions director is to facilitate a successful admission to a post-acute rehab facility. And a large part of that is understanding what goes on behind the scenes at a hospital to ensure a safe patient discharge. Kelly's going to talk to us about how hospitals communicate to patients, their families, and among their care teams. She's also going to talk through why it seems like maybe you're waiting endlessly and then things happen very quickly. She's going to talk through how to advocate for a patient's rights and what hospitals would like you to do to be prepared, even if the hospital stay is unexpected. Thanks for listening. Hi, everybody. Welcome to today's episode of Aging Well Anyway. I'm joined by Kelly Wheeler, a longtime admissions director and patient advocate. And today we're going to talk about what hospitals want you to know before you go. We're going to talk about with Kelly some ways to alleviate some of the stress that can come with a hospital stay to hopefully make it easier to navigate. Welcome, Kelly. Thanks for coming.
Thank you for having me.
So I think we all know, but can you explain maybe why do hospitals make us so anxious? They're places of care and healing and full of doctors and nurses and social workers and everyone to help diagnose and to treat. But yet, sometimes we feel very, very anxious. They can be very stressful. Can you tell us, why do hospitals make us so nervous?
Absolutely. It's the unknown. You don't know what's going to happen. You don't know when the next test is going to happen. You don't know if it's change of shift. Nurses can change, doctors can change. It's all an unknown. And that can make you anxious because when it comes to a loved one, you want to know everything.
Yeah.
You want to know every step. You want to know why they're doing. You want to know what they're doing. You want to know who is doing, who is caring for your loved one. And that can create a very anxious environment, not to mention your loved one is sick. Your loved one needs to be in a hospital or in an emergency room, and you don't know what's going to happen. And that can create so much anxiety. And you're relying on professionals to tell you about the person that you have known for 60, 70, 80 years that you know better than they will ever know.
Well, I think it's a good point. I mean, you only go to the hospital when you absolutely need to, when it's necessary. So, I mean, I think we should point out that you go to the hospital either for a scheduled surgery, it's planned, but a lot of times it's due to an illness or an accident or an emergency, and you don't have a lot of time to plan. I mean, if I were today and I'm thinking about, my family members, what should I be doing now to plan for going to the hospital? Even if we don't have anything scheduled, is there anything I can do to help prepare?
Absolutely. You should have a copy of their insurance card back and front. You should have a copy of their current meds, diagnosis, and who prescribed them.
Oh, that's interesting.
You definitely want to know what's the dose. That's a very important thing to have. Primary care, who's mom's primary care? You want to know that. Also, when you do go to a hospital, go to an emergency room, they will pull up on that computer a list of medications that might be 2 feet long.
Yeah.
But many of them were discontinued, but they don't know that. So having current medications is so important, especially if a physician is going to prescribe another medication. It may have an interaction with what you're currently on.
Okay.
Have that information and always grab a pen and a pad. So important. If you don't have one, a nurse's station will absolutely give you a piece of paper and a pen.
Okay.
Because you want to write down also who's caring for mom or dad.
the names of the people you're interacting with, the medical team at the hospital?
Absolutely. You want to have that. What department are they in? This was my nurse at 2 o'clock. Why do I have a different nurse at 4 o'clock? Did you get a complete report? Can you tell me the report that you got on my mom or dad? What was the report handed down to you? Because there could be mistakes because that nurse might have 15 patients. So you want to know what report was given down. Is it accurate? Is that truly mom? Are those truly the meds that they told you about? So be that advocate for them.
So make sure that you see all of the information maybe that's circulating around your
Absolutely. And it's your right. It's your right.
to see that. Okay.
Mhm.
Oh, and then in the hospital, so even the emergency room, or even if you're admitted, there are a lot of people coming in and out. Do you rely on one person? Do you have to identify one person as the point of contact for communication, or can you ask anyone who's caring?
I would suggest, as far as a point of communication, as far as the hospital goes,
Yes.
you're going to have many points of contact. As far as a family goes, it's always good to have one family member appointed to communicate to, because you don't want 6 brothers and sisters all calling in. You want to have that one point of contact, but you also always want to know who those doctors and nurses are. If you're admitted, you want to know. They might write on a whiteboard, "My nurse is Carrie. I'm your nurse today." "Great, Carrie. What's your last name?"
Really? You can ask that?
I would ask it. They could say no, but I certainly would want to know. What if there are 3 Carries on the unit?
Okay.
I want to know who it is. I want to know who the doctor is that stops by to check mom or dad. I want to know your doctor, whoever, you're from what specialty. What have you found out? What are you thinking? You ask all the questions you can ask. Gather the information. My father in law was in the hospital for about 4 weeks. We kept a notebook by the bed. Everybody that visited would write in the notebook, and then they would write down who came in, what medical profession came in when they were there visiting.
Okay.
It's important to have that information because you can always look back and say, "But Dr. So and so said this. Why are you recommending this? It seems counterintuitive. Can you explain why?" And that's a really important question. Can you explain why? You know, "Mom needs a CAT scan. Can you explain why?"
Okay. Oh, that's
And it's
important.
within your right to ask that.
Okay, it's within your right to ask what tests they're requesting. And sometimes they may say, and you just forget. I really like that idea of a notebook by the bed. So whoever's there, you write it down. And so, one person on the family side, you're recommending to be the primary communicator. So the hospitals know.
Somebody to call in. I was that person for my father-in-law. So they knew when I called, they could give me the information. He gave me power of attorney, so it was okay to release that information to me. It was legally okay to do that. And then I would pass the information along to the rest of the family, but they knew that I was able to interpret what they were saying, so I was appointed that person to be that power of attorney. And I also had the knowledge, the skill, and the gumption to say, "Why?
Yeah.
Why? Had that test yesterday. Why does he need it again?" It's okay to do that.
And you have all that information because you've continually written things in the notebook to say,
Right.
okay.
Right.
And so you're saying, you can ask any of the medical team.
They're there to help you.
Yeah.
They're there to help your loved one.
Yeah.
And if you have the legal ability to ask why, you also have the right for an answer.
Okay. Oh, good point. That's a good point. So let's talk through, maybe 2 scenarios. The first is your loved one has an illness or an emergency, goes to the emergency room, and you're lucky enough or fortunate enough to have someone who can go with that person.
Mhm.
Not now with, the world has gotten so big and so small all at the same time, and family may not live close by. So if your loved one goes to the hospital and there's no one there to accompany them from the family, what are your options?
Phone calls.
Phone calls. And do you have to identify that you have power of attorney in order to?
Yeah, absolutely. And what I have done, and I have also told family members this, fax your power of attorney over, because you can say, I have power of attorney,
Yep.
fax it over.
Okay.
I want it in the chart, and then follow up to say, is it in the chart?
Okay. Oh, good point.
Because what if it's on, it could be on a countertop of papers and it's not in the chart.
Okay.
Do you have it in the chart? If it's in the chart, then they can give you that information. Follow up, follow up, follow up, follow up, follow up. And if it becomes annoying on the other end, that's okay. It's your loved one.
Right. Yeah. It's
It's your
okay.
job.
Yeah. Well, we're also used to being polite and, and the medical professionals deserve your respect, but they also need to understand that, you're trying to gather as much information and advocate for your loved one who is
Oh,
under the.
and absolutely be polite.
Yeah.
Absolutely be polite. Be kind,
Yeah.
but firm.
Yeah. Okay.
Firm. And be firm from the start, so that if there's a waiting line, you're going to have a CAT scan, but there's a 4-hour wait. Why?
Okay.
Why? Was there an emergency? Did you have to take someone from a car accident in before me? I get that.
Yep.
I 100% get that. But I'm going to be here for only a couple hours.
Yep.
I'd like it to happen now if possible.
Okay.
It's worth asking. They can say no. That's the worst that can happen.
Right.
They'd say no. What if they say yes?
Right. Right. Okay. So that's an emergency room visit. And I just wanted to touch on one thing. If you only have a few minutes, so say there's an emergency and your loved one's being transported to the emergency room by an ambulance, and you only have a few minutes to grab a few things. I heard you say notebook and pen. So you want that. You're planning ahead. So you're creating a list of current medications, who prescribed them, front and back of the insurance cards. Is there anything for comfort that you can bring to an emergency room, a blanket or a pair of slippers or something that's going to make them comfortable because it could be a long stay?
A blanket and a pillow. I cannot tell you how many times I wished I had had a pillow for my mom,
Yeah.
because the pillows are not, comfy hotel pillows.
Yeah.
Bring a pillow, bring something comfy, bring a blanket, because they will say, oh, I'm going to bring you a heated blanket.
Yes.
When an emergency comes in, you don't get a heated blanket.
Yeah.
Bring the blanket.
Okay.
That's important. Also for my mom, because she did have dementia, I brought a picture
Oh gosh, that's so smart.
by her bedside, just because it was a new environment. It could be a scary environment.
Yes.
To say, or I often recommend one of those little flip, that you can put like 20 pictures in,
Yeah.
something
A
small to put
small
in your purse.
album. Yeah.
So when there's time, and if mom or dad has dementia, to say, look here's your granddaughter, here's this,
Yeah.
remember this, remember this. And it can sometimes bring that anxiety or that fear down, because they're looking at family.
Oh, that's so interesting. That's a really good idea. That's such a good tip to bring a little familiarity into this very unfamiliar and stressful environment.
And if you don't have time, and if you don't remember, keep it in your glove box.
Yeah.
Grab it.
Yeah. And a lot of us have photos on our phones too, so we could flip through, but knowing that that is a source of comfort.
And you can leave it behind.
Yes.
Put a name on it, leave it behind,
Okay.
or within reach, and mom or dad could look through it.
Yeah.
It's just so important to bring every bit of comfort you can.
That's a great idea. I know I've been in the emergency room with several family members, and I remember thinking, oh, I wish I had something soft for them. I wish I had something familiar for them. And nothing is, even if you say, oh, can I go to the gift shop and get something there? It's new still.
It's still new.
That's so
It's not all broken in,
Right.
and it's not all comfy, and it's not mine, which will happen a lot with, as far as a dementia client. It's not mine.
Yes.
I want mine.
That's really good advice. I like that a lot. So let's say now that your loved one is admitted, whether from the emergency room or they had surgery and they're recovering in the hospital, they've been admitted. And again, as we're talking, you're having a lot of medical professionals in and out of the room. We're keeping track of everyone. We're asking for updates. We're asking for advice. And a lot of times you'll feel like you're waiting, they're staying another night. Oh, we're going to keep them one more night. And then all of a sudden, it's time to be discharged. And sometimes it can feel very quick to the family who said, wait, you just told me you're keeping them another night. And yes, it's the next day, but it's 8 in the morning the next day, and you're saying they're ready to be discharged. Before we get to the family member and how to navigate a safe discharge, what's happening behind the scenes? Because this decision wasn't made at 7:55 a.m. and they're telling you at 8 a.m. Do the medical professionals that are on your parent or your relatives or your loved one's care team, are they communicating behind the scenes?
I'm sure they're communicating, but often a rush discharge means that they need bed availability. So feel free to push back. Feel free to appeal. Appealing is your right. We're going to discharge you at 9. Actually, I want to appeal this decision. You want to check the date of admission.
Okay.
A lot of folks could be kept in an emergency room for 23 hours, then admitted. That 23 hours does not count as a day if you wanted your Medicare benefit. You
Okay.
need your 3 midnights. Ask for your admission date.
So when you are discharged and you're going, and this is important when you're being discharged and you're going to a rehab facility and you want your Medicare benefit to kick in, you need that 3 midnight overnight stay.
3 midnights. Yep.
Being
And some folks might
admitted.
be, you've been here 3 days. No, my first day I was here in a 23-hour bed, which emergency rooms have. A 23-hour bed, they discharge you at 24 hours.
Okay.
That does not count as your day 1 or your night 1. So it's important to know your admission date to use your Medicare benefit.
Okay.
If it's a managed care benefit, that's a whole different story. You can stay for an hour,
Okay.
or you know what I'm
Yes.
saying.
Well,
And then
yes. So
and then get your approval, and then get, you know what I mean. So it's important to ask all these questions.
and to understand your insurance coverage.
Mhm.
Okay. That's important. That is another episode, I think, entirely understanding your insurance coverage. But I am hearing you as far as saying you must have the 3 overnights admission in order for Medicare to be considered as a payer source for rehab. So let's say you're being discharged. They're telling you you're being discharged. You're comfortable with that decision. So no appeal. You're saying, okay, we want to move our loved one to the next step.
Mhm.
Who determines where they go?
You do. You will get a list, and the standard is 5 facilities.
So this is if they're not being discharged home.
Right. If they're being discharged to a facility for rehab,
Yes.
you're going to get 5 facilities.
From
Those
the
5
hospital.
facilities are standard, yes, from your discharge planner.
Okay.
And those are generally standard, and they could be hospital affiliated. May not be where you want to go, may not be within your geography.
Okay.
And you also have that right to say, great, I want to tour these facilities
Yep.
before this person is discharged. And you have that right. You don't go blindly into the next stage of care, and you should not be expected to.
Okay. So if they're saying we're going to discharge your loved one this morning, here's a list of 5 places we would like to discharge to, depending on their availability for an admission. And you can say, okay, this list of 5 looks fine, but I would like to tour. Are you, going to leave immediately and go to these places and request a tour, a walking tour? You are.
Yes, I do recommend, however, calling ahead to talk to the admission director to set an appointment, only because admissions is very busy. And it wouldn't be the kindest to leave a family member waiting in a lobby for 30, 40 minutes until you're free. And you also, may not want someone else giving that tour because you as admissions, you know that building the best.
Yes. Okay.
And you want to answer the questions that someone else may not be able to answer correctly.
Okay.
If someone is going home, they may also give you a list of home care agencies, again, a lot of which are affiliated with the hospital.
Okay.
But you may have a favorite. You may have someone closer. You may have heard of XYZ home care that did a great job, but they're not on the list.
Okay.
You choose. They guide, you choose.
That's perfect. They guide, you choose. That's important. And that goes hand in hand with the advocacy role of the
Mhm.
family member. What if
Yep.
you're not close? Or, what if I'm on a family vacation and something happens to my loved one and they're in the hospital and they're being ready to be discharged? I can't physically be at this rehab facility to walk around and look and ask questions, but I can go to their website and I can take a look, at the pictures that they've put up there. Is there something more that I could do to make sure that I'm comfortable with making that choice?
I would not rely 100% on a virtual tour online because they could be staged.
Okay.
You want to call and set up a meeting with that admission director
Yes.
to give you like a FaceTime tour.
Oh, good.
You can't show residents,
Right.
that's privacy, but you can show a dining room. You can show an empty bedroom. And sometimes I have had in my career staff members that are very willing that I trust
Yes.
to also speak to the family member.
Okay.
And that's important to build that. But if that's not available, again, you can look online as far as Medicare.gov, realizing that a 5-star facility hasn't probably not had a survey in several years due to COVID. So they were a
Oh,
5-star facility in that snapshot of time. But here we are several years later, are they still? So it's best to look at when you go on Medicare.gov, you can also view recent complaint surveys. And that's extremely, extremely important to do is to review any complaint surveys. If it's home care, talk to the owner. How is your staffing? How soon can you get out? How is your pricing? Do you have reviews online? You have the right to have that time to gather all that information to make that smart choice.
interesting. So you brought up something that is very interesting, that we're still dealing with the effects of the shutdown that happened during the pandemic. So
Mhm.
you're saying if we go on Medicare.gov, which I know, a lot of people rely on that star rating, but that star rating may be outdated due to they haven't had the opportunity of having a survey. And I guess it can go both ways. So you could see a facility online that has 5 stars, but like you said, that was a snapshot in time several years ago. They have not had an updated survey just due to no one's fault. It's just we're still catching up. But the
Right.
flip side could be true that if you see a facility that's close to you, convenient, you've heard good things about it, but they may be a 3 star on Medicare.gov, that really was a snapshot of time. That could also be an outdated measuring stick because even though they've made improvements based on their last survey, they haven't had the opportunity of a more recent survey.
Exactly. And also, I would say reach out on Facebook. Has anyone had an experience at XYZ facility and can you tell me more about it?
Yeah.
Reach out to your community.
Yeah.
Reach out to your senior centers because your senior centers also have that population that has been to these facilities and sometimes recently that can tell you
Yeah.
about these facilities. And if also for a home care, they can tell you all about a home care. If they've had that with a spouse or with them, they can also tell you. Senior centers are incredible, incredible sources of knowledge when it comes to that level of care.
That's so interesting. And then you're getting firsthand information. And I think, we can say one person's opinion may not be another person's opinion, but at least you're gathering information to make an informed decision, which, as we mentioned, could be a very short time frame. You might be having to make this very quick decision.
And I can't emphasize enough when you talk to everybody, write it down. You're in crisis, you're in a rush, you're going to forget, write everything down. Everyone talks to you, write it all down. Joe said this about this. Because you also, if you are the point person for that family, you want to be able to share that with your family as well. And in all the commotion, you might forget. Write it all down.
Right.
And then when you get to any facility or you get a home care, continue to write down caregivers. Continue to do that. It's so essential.
That's so important. And I guess, as you're talking and I'm thinking, as you're writing things down, having a list of questions that you ask, a list of your standard questions that you ask each organization that you're considering. And you had talked a little bit about, asking questions of a home care agency about staffing. I mean, if you were to say, ask these 3 questions of every organization that you're considering, what would those 3 questions be?
Are they allowed to be on their phone
Oh,
while they're caring for your loved one if it's a home care?
okay. And that's so someone on the phone can participate in what's happening?
No, a lot of folks that might do caregiving. I've seen folks that do caregiving at home that watch TV on their phone
Oh, the
or text on their phone.
caregiver is on their
They're
phone. Oh,
they're not caring for the person they're there to care for. Another thing, if it is an English speaking person, is English their first language
okay.
or not? Because you want to understand and you want to communicate with the person you're taking care of. And as you get older in your hearing, you want to be able to communicate back and forth.
Okay.
And that's critical. And also, are they qualified to give meds? That's an important one. It's a licensure
Yeah.
and it's important. Rather than setting up the meds and saying, Martha, you need to take this med now. Are they qualified to not only give the med, but make sure the med was taken? A lot of folks pocket, they don't take it, they spit it out, they don't want it.
Yeah.
That's important.
Okay. So that's for a home care agency that's going to be
Mhm.
providing care in the home upon discharge. If I were to tour some rehab facilities with the admissions director, ideally, or a FaceTime tour with the admissions director, what are the top 3 questions I should ask that admissions director before my loved one goes to that facility for rehab?
Staffing. Staffing has to be posted every day. They can take a snapshot of posting, of that posting.
Okay.
You want to know that they have the staff that's needed to care for someone.
Okay.
Extremely important. How often do you use pool nursing or pool CNAs? Because if they bring in someone from an agency,
Yeah.
they don't know your loved one. They don't know how to care for your loved one.
So
So how
pool
often is that brought in?
versus community staff.
Right.
Okay. So the
Right.
organization has their staff, but if they need to fill in gaps, they would go to an outside resource. Okay.
Exactly. And that outside resource may not read a care card, may not read a care plan, may not feel like they need to. They may think that I have this, I can do this.
Yeah.
But if you don't know the care plan
Yeah.
of how to care for that person, you need to know who's taking care.
Yeah. Caregiving for consistency of care.
Mhm.
Okay. And number 3.
And number 3, any complaint surveys are listed in a book that has to be available to everyone. It's generally kept behind a receptionist desk.
Okay.
Ask to view it. Ask to see if you don't have time to look it up online, ask to please see their survey book
Okay.
to see what those concerns might have been.
Okay. And you can ask when was their last survey, correct?
Yes, you can.
Okay.
Absolutely. I would also ask as maybe number 4, how long has your administrator been here? How long has your director of nursing been here? how long have you been caring for patients?
Okay.
Do you have long-term staff? A lot of that goes to the quality of care of a building or of a home care.
Okay. And so just to bring it back around, these are all things that are going to help the hospital discharge
Oh,
your loved one.
absolutely,
Right.
because you're not going to discharge a loved one unless you have all the facts
Right.
and you have that right. And remember, when it comes to Medicare or managed care, you have the right to appeal
Okay.
and say, I'm going to appeal, which will give you another day or two
So
to do your research.
So that's hugely important because I think when you feel, and I've heard from client families who say, we were in the hospital, we were waiting, and then all of a sudden I get a call saying, my parent is ready to be discharged, and I've got to make a decision based on the list that you had mentioned before. So making sure that you have all the information in order to have that, discharge that's comfortable to everyone is so important.
And safe, and safe, and safe is the one word I use so much in my job, in my career. You want a safe discharge, and never be shy to say to a discharge planner, I don't feel it's safe right now. I need to do my research to make sure that mom or dad is safe where they're going. And when you say that word safe,
They know.
they know.
They know. Kelly, this has been hugely helpful. It is so important to advocate for all the loved ones in our lives, especially, as we are encountering just an aging population that is growing. Healthcare needs are getting more and more complex. Hospital stays are getting shorter and shorter, I feel like. And so, in order to advocate and empower families and loved ones to advocate for their patient while they're in the hospital and beyond.
And beyond, I have my children's list of medications. I know their social security numbers. I have their primary care physicians. I have my husband's information. I keep it all in my wallet, all tucked in, because if anything ever happens, I know I'm the advocate for whomever, a child, whomever, you're their advocate, have all the information that you're going to need so that person is safe and has a safe outcome.
Kelly, this was great. Thank you so much.
Thank you for having me.
Thank you. This has been wonderful.
It has been amazingly wonderful, and I just love what I do. I love advocating for the elderly.
And for everyone listening, Kelly's contact information is going to be in the show notes and available to everyone. Kelly, thank you so much.
Thanks, Liz. I appreciate it.
If you enjoyed today's episode, please feel free to leave a comment, like, or share with a friend. Now for the legal language. The opinions and information shared in this podcast are for general education and informational purposes only and should not be taken as professional legal, medical, or financial advice, nor should it be a substitute for legal, medical, or financial advice from a professional. We are not lawyers, doctors, or financial advisors, and you should consult with a qualified professional for specific advice related to your situation. All content, including audio, images, and text, is the property of Aging Well Anyway and is protected by copyright. Reproduction or distribution without our express written consent is prohibited.